Hi, I believe a single-payer healthcare system is a step in the right direction for overhauling our nation's healthcare crisis. Even though universal healthcare is often called impractical and expensive, and many feel it will not work, I feel the single-payer system will not only benefit the country's economy, but the overall health of our people. Because the single-payer system will improve the overall health, it will also save lives. This model has been proven successful in many developed countries, including Australia, Sweden, Taiwan, and Canada. What is a single-payer healthcare system? It's a system where a single public organization finances all healthcare. They pay for services at a set price. In America, we have thousands of payers, and most of them are paying at different amounts for the same care. America currently has a version of single-payer health care. This comes in the form of Medicaid for those 65 and older. Why is it that Medicaid is a great idea for those 65 and up, but when it's suggested for the 65 and under crowd, the mere discussion of a single-payer health care system causes the vehemently opposed to call it a socialist system? I truly believe that health care is a basic human right. A family should not have to choose between paying the mortgage or paying their astronomically high insurance premium, a premium that merely pays the monthly fee. The family may not even be able to afford to use their insurance with the out-of-pockets, the deductibles, and the co-pays. Many don't even see their doctor unless it's for something catastrophic. L. Randall Wray, a professor of economics at Bond College in New York, argues that health insurance should work differently than the way we insure our cars and homes. Since insurance is set up to be a bad deal, consumers pay premiums to protect themselves from rare events like house fires and high-impact crashes. Going to the doctor should not be like going to the repair shop. As humans, we require preventative care, and for-profit insurance is not set up to provide that. Does a single-payer healthcare system work? As I mentioned before, many developed countries have a single-payer system. Countries such as Australia, Sweden, Taiwan, and Canada have successful single-payer models. All of the countries I have mentioned outrank the United States in healthcare. The World Healthcare Organization ranks the U.S. as 37th. For the sake of time, we will only look at the single-payer system of our neighbors to the north in Canada. Canada's single-payer system is also called Medicare, but instead of covering only those 65 and older, everyone is covered. Canadians are covered for all medical procedures, routine care, and even infertility treatments with no out-of-pocket costs. Most hospitals in Canada are publicly funded and have to operate on a fixed budget. This is how they control medical spending. The physicians work privately on a fee-for-service basis. This is what classifies Canada as a single-payer system as opposed to a socialized medical system. What about the wait times we hear about? I know I have heard many arguments about Canadians and others from around the world traveling to the U.S. for medical care because they would wait years for the services at home. According to the article, Waiting Your Turn, Wait Times for Healthcare in Canada, an article published by the Fraser Institute in December 2017, wait times depend on who you're seeing. If you're waiting for an appointment with a general practitioner, Canadians wait 10.2 weeks, or for a specialist, 10.9 weeks. Patients in Canada waiting for medical oncology started treatments in as little as 2 to 3 weeks. I personally don't think those are terrible wait times. When my family practitioner retired last year, I waited 8 weeks for a new patient visit at a new office, and we waited 9 months to see a child psychologist the year before. As for Canadians crossing the border for treatment, it's just not the truth. An October 16th article by Kaylee Rogers titled Fact-Checking Trump, Are Canadians Swarming the Border to Get Better Health Care? Less than 0.5% of the most wealthy Canadians seek health care in the U.S. Why? When surveyed, they said it's just too expensive. We can now see that a single-payer healthcare system has worked well in a developed country by making healthcare affordable to everyone. In addition to making healthcare available, the single-payer healthcare system will lower the amount of money spent on healthcare in our country. The United States is the only developed country in the world without a single-payer healthcare system. No, that doesn't mean they all have better care than we do or that the system is working perfectly, but it is working. The United States spends the most on healthcare in the world, at about $9,451 per person, compared to the $4,608 Canadians spend. That's almost half the amount. Lowering the amount of money spent each year on healthcare would lower the federal debt. Currently, the U.S. spends $2.4 to $2.8 trillion a year on healthcare. A single-payer system is estimated to cost approximately $1.38 trillion per year, according to an article on PolyFactChecker. While it's easy to see the benefit of saving money on a federal level, a single-payer system will also help the little guy by lowering the costs on private businesses. The astronomical cost of providing health insurance for small businesses is a problem faced by many would-be business owners and budding entrepreneurs. This often leads to understaffed businesses or the loss of the business altogether. With single-payer healthcare, businesses could lower overhead costs, leading to more small businesses, more local jobs, and helping the local economy thrive. In conclusion, a single-payer healthcare system is a win-win for everyone. A single-payer system has a successful model in many other countries. It would lower the amount spent by the taxpayers. It would increase good health care to all Americans, and it would help small businesses succeed and revive local economies. Please support the single-payer healthcare system in America.